Hello, my name is Winnie and I was on the February 2026 Pata team through International Health Services of Minnesota. I'd like to tell you a little bit about that experience and what it meant to me and why I think you should support this work. It all started when I responded to a call by Dr. Rick Olson on the Wilderness Medicine Society message board. He was asking for volunteers to help teach and do cervical cancer screenings in rural Honduras. Well, I've never been to Honduras. I didn't know Rick. I never heard of Pata or IHS. And I knew pretty much zero about cervical cancer screenings except it had something to do with pap smears. But I've traveled and worked enough in Latin America that my Spanish is pretty good. As a flight paramedic, I specifically look for jobs in remote areas because inequities in healthcare drive me crazy. So I'm always up for anything that helps bring basic life-saving medical care to isolated communities who deserve the same kind of care that everybody else gets. So I asked Rick if I could join his team and learn more about the work and help out in any way he thought I might be useful. And he said, great, buy a ticket. So I did. What I didn't tell Rick was my family has dealt with a fair amount of cancer to the point that I started getting mammograms in my early 20s. And I always found it nerve-wracking, those couple of weeks that it took to get my results. I'm not an anxious person by nature. I just think that when you get screened for something as scary as cancer, you want an answer as soon as possible. Part of your brain is just held hostage until you get the news. A few years ago, I discovered that there's this place about an hour's drive from my house where they do the mammogram and give you your result before you leave the building. What a game changer. Now I'm so excited to go get my mammogram, which I know sounds a little weird since it's really uncomfortable getting your boobs squished, but it's all about getting the news right away. I mean, I almost can't put into words how much it means to me to walk out of there knowing that I'm okay until the next cancer screening. The relief and the emotion just wash over me. And I personally saw that same relief and emotion on the faces of over 100 women when they walked out of their cervical cancer screening in various villages in Honduras. I recognized it right away. And when I talked to them about it, they confirmed that's exactly what it was. It was relief, it was empowerment in knowing what their status was. I just think it's pretty amazing that women who come from such different worlds can share a common experience like this. So these cancer screenings not only save lives, they improve the quality of life for every woman who can access a screening and get the results. She no longer has a specter of doom hanging over her. She's empowered, knowing whether she has cervical cancer or not. She knows what her timeline is for her next exam. She now has local healthcare workers who have the tools and the know-how to do that screening and give her an immediate result when it's her time again. It's a game changer. In Honduras, breast cancer is more common than cervical cancer, but cervical cancer is the #1 killer. Honduras has the 3rd highest mortality from cervical cancer in the Western Hemisphere. It's 4 times higher than in the United States. And for rural women, they have to travel hours just to get a pap smear, so most don't. And even for those that do, we heard countless stories of never getting a result. And on top of that, if you're an indigenous woman in the Americas, cervical cancer is the #1 cause of cancer deaths. So what does it mean to be a woman who's Honduran and lives in a rural area and is indigenous? Well, this, my friends, is where Para Ella shines some hope on the situation. It takes multiple days of travel by jet and increasingly smaller aircraft after that until you finally land on a little dirt strip in the jungle, or you have to go hours by pickup truck or a boat across a lagoon, and you finally get to these remote villages. And we teach nurses and doctors and healthcare technicians a simple, low resource, fast and effective cervical cancer screening technique. Because cervical cancer is preventable. It's detectable if you look for it, and it's treatable if you find it early. Women should not be dying from this anywhere. Now, the Honduran Ministry of Health is working on prevention. Girls now receive the HPV vaccine, which is up to 70% effective at preventing cervical and other cancers. And when we visited these remote clinics and rural hospitals, they all had a solar battery system and their vaccine refrigerator hooked up to it, stocked with their HPV vaccines, which they give right now only to girls. We're hoping boys will be included in the future someday, but hey, it's a big start. And we also had some of those girls that had received a vaccine 10 years ago come and get cervical cancer screenings. So that's starting to come full circle. The screening method Para Ella teaches to detect cervical cancer is easier than a pap smear. First of all, you don't collect a sample, so you don't need a lab. There's no waiting for results. It's immediate. And it's just as, if not more reliable than a pap smear. It's low tech and high reward. Now, if the practitioner finds any abnormal cells, depending on the age of the woman, they'll either have her come back in a shorter time period so they can see if her body healed up those abnormal cells, which many times younger women will. Or if she's older, then we have a concern that those abnormal cells could turn precancerous and then become cancerous. So Para Ella has this really cool ray gun thing called a thermocoagulator. We actually have 2 of them. So when we had teams going to different places, we could split up the resources. And we also found some working units in some of the rural hospitals where we taught the staff how to use them. And they can actually zap those precancerous cells before they have the chance to turn into cancer, thereby preventing the cancer from ever getting going. Finally, sometimes there's women who, during their exam, we find they already have full-on cancer, and they get an urgent referral to a GYN to discuss what their options are, which might be surgery, for example. And, well, that's basically everything I learned about cervical cancer on my summer vacation, or my winter mission with IHS. No, seriously, I think supporting Para Ella is a no-brainer. We are sharing appropriate knowledge and technology with dozens of isolated healthcare workers who can immediately put it to good use. And they are the force multipliers because they will in turn make a huge impact on the lives of hundreds of women in their catchment area who travel up to a half day by foot through the jungle or in a dugout canoe on the rivers. And the improved health of so many women will rise up these communities. So I think you should join us. If you have the time and the means, come on a mission. It's an amazing work to see firsthand. And if you don't have the time, then support us with a donation. And Dr. Rick and his team will make every cent count. Thank you for helping us. Para cancer. Para ella.